to use ultrasound to insert an IV, and this patient has had difficulty in the past, so I've got my ultrasound machine ready to go, and I use gel at the end. I start at the anticube because we all know there's great veins there, and right there is a fabulous vein. It's compressible, so we know it's not an artery. So what I want to do is just follow this distally down the arm, just keeping the black in the center of the screen, continuing to press. If I go to the side, I can find that cephalic vein. I really don't want the little, I want the big, and we can see this is at a 1/2 centimeter right there. That's a great depth for a 1-inch IV. So what I'm going to do is I'm going to leave my ultrasound right at this location here on the arm. I'm going to wipe away any excess gel because it's not sterile, and I'm going to use my alcohol swab to cleanse the site, keeping my hand on the ultrasound the whole time, watching, making sure that my vein is still centered. The location I've selected is midway through the forearm, allowing the patient to bend their arm without any kinks or problems. So I have a little bit of lidocaine here, 1%. You're going to feel a little pinch. This is right above the vein. You're going to feel a little burn. Go nice and slow. That does help reduce the pain of the IV insertion. You can tell the patient to take a deep breath until that's done. 1 to 2 mils, just nice and easy. Engage your safety. I have my catheter ready. At this same insertion site, and I look up at the screen, I'm going to go in that same insertion site, and now all I'm doing is looking at the screen. And as I go in at about a 20-degree angle until I see compression of the vessel, and then I see the flash right in the center of the vessel, and you feel a release. Now I do see the flash on my IV, but I don't want to let go now. I want to advance it, move my probe up, and then keep the needle directly in the center of the vein. So if we look on the screen, you can go left to right, up and down with the needle without catching any of the side of the vein. So I advance it a little bit more, ensuring that I haven't caught anything. And at that point, I'm done. I can advance the catheter all the way, engage my safety. I have a beautiful blood return. So there may be still a little bit of gel, so just wipe that away. Undo your tourniquet. You can take a little bit of alcohol. Once again, cleanse the site. And at this point, you can put your occlusive dressing on, making sure that this is dry without blowing or waving at it. Then you can flush your catheter to ensure that it's in the vein, flush, and you should get a rapid blood return back. Then you know you're solidly in the vein. And I'll flush my other cap. And then secure your IV like you would for any other insertion. And you've used ultrasound to insert an IV.